The color pink has been popular lately, especially with the color being used by one of the candidates running for presidency in the 2022 elections. This color not only symbolizes this certain politician, but also symbolizes what we're going to talk about in this episode. Do you already have a clue on what it is? Yes, you're right. We're going to talk about breast cancer as the month of October is also Breast Cancer Awareness Month. In this episode of Lifeline, we will be tackling what breast cancer is, how we can prevent it, and what lifestyle should we be practicing. Join me together with an expert to know more about breast cancer. I'm Zarina Ancheta, your host for today. This is Lifeline. We improve our lives by feeding our minds. Show our support for celebrating and raising awareness for Breast Cancer Awareness Month. Along with me is our guest, who is a part of Philippine Breast Cancer Society's Board of Directors, a faculty member of UST's Faculty of Medicine and Surgery, and an oncologist at UST Hospital and Cardinal Santos Medical Center. Without further ado, let us welcome Dr. Clevelinda Calma. Good afternoon, Doc Calma. We really appreciate you being here, Doc.
Thank you very much for this opportunity as well.
So to start, Doc, can you share with us what breast cancer is and what are the signs and symptoms a woman should look out for?
When we talk about cancer in general, we talk about cells with uncontrolled growth. Therefore, when we talk about breast cancer, we talk about uncontrolled growth of breast cancer cells. So breast cancer per se means it's primarily from the breast. Signs and symptoms, well, I always tell patients in all the talks and when you read literature, signs and symptoms would refer to obviously a lump in the breast, changes in the skin, whether it's thickening or dimpling or discoloration. If there are discharges, bloody or unusual from the nipple, if there is a retraction of the nipple or the nipple goes inward when it was not like that before, and any changes you see. That is why it's important that we are aware of how our breasts normally look like.
I agree with that, Doc. So some say that you can develop breast cancer at a young age. Do you know what is the common age when women may start to develop breast cancer?
May I just put in something else? No, it's not only women who have breast cancer. Actually, a very small proportion of men can have breast cancer. But breast cancer is known to be the incidence of breast cancer is known to be very low at around 20s, but it increases as one reaches 45. But personally, the youngest patient I've seen with breast cancer is 18.
So it really starts at a young age po pala talaga. So let's now move on to the prevention side. What lifestyle, Doc, do you think should we be practicing to prevent having breast cancer?
Breast cancer can be genetic, but I agree that there are lifestyle factors that we can change or modify to decrease our risk. Foremost of this is obesity. Obesity is known to increase the risk of many cancers and also breast cancer. So important lifestyle changes would be a low-fat diet rich in fruits and vegetables, and then of course exercise. Usually referred to aerobic exercise, but we also need to include conditioning exercises and strengthening exercises, as well as stretching exercises. Of course, it goes without saying to avoid drinking alcohol and smoking cigarettes. Or even, of course, there's no study yet because it's relatively new, but even vaping.
So there are a lot of factors that we must consider to avoid breast cancer. And that's one thing that people should always take note of. Okay, moving on. Are mammograms helpful, or are there any clinics in the Philippines that could detect cancer cells or genes?
So mammograms have been established as effective screening modalities for breast cancer. However, the recommendation for mammograms would start at 40 years old. But I said a while ago that breast cancer can happen to even younger women younger than 40 years old. So equally important to mammograms would be your self-breast exam which we should do. If you're menstruating, you should do it between from day 1 to day 7 of your menses. If you're not menstruating anymore for one reason or the other, it's best to assign a specific date or day of each month to do that. In addition, you need to get a clinical breast exam. What's a clinical breast exam? It's an examination by a physician who's well-versed in detecting even small lesions. And recommended clinical breast exam is once a year for those who are over 40 and every 3 years for those under 40. You have to go to a physician, whether it's a surgeon, an internist, an OB/GYN, or even your primary care physician to help you check for breast cancer. Kasi number 1 would still be physical exam. What would address yung mga mammo, syempre yung mga laboratories, but there's actually no lab test, no blood test that can tell us the risk. Any reputable laboratory or hospital should at least have the 2 most important things in early detection, which is a mammogram with or without an ultrasound of the breast, and a physician who is well-versed in examining changes in breast tissue.
Okay po, Doc. Thank you for clarifying that. Now, can you tell us if there are any support groups that can help those with breast cancer?
Okay, there are a lot of support groups. There are some support groups that are very specific. Plenty of them all over the Philippines. I will mention though that in the University of Santo Tomas Hospital, we have a support group. It's called CanShare. Although it's not generally just for breast cancer patients, but because breast cancer is the top cancer in the Philippines, many of the members of CanShare are actually breast cancer patients, survivors, and friends. Nationally, what you probably have heard of, the most popular, I would say, is I Can Serve. It's a well-structured organization, but there are a lot. It's important for us, for our viewers also, to keep on asking doctors, other patients, friends, and even look at social media, but be very wary lang of social media. We know that not everything we see on social media is correct.
Yes po, Doc. That's why I think it's really good that there are support groups all over the country, and as you've mentioned, starting within UST, right?
Yes.
Now, after finding out that she is diagnosed with breast cancer, should a woman or a man be afraid, and what should be her or his mindset?
It's very easy to say, don't be afraid. But this is something unknown. It's an illness that's protracted, but it can be cured. I always tell patients, you're not supposed to be afraid, but if you are, that's okay. That's understandable. That's acceptable. Use that fear, channel that fear to go seek medical attention. Because breast cancer, especially in the early stages, is something that's curable or controllable. In the late stages, so many things can still be done.
So I think that's really good, Doc, explaining to us what breast cancer is, and that it does not only affect women, and that it also has a lot of factors to consider on how to have a healthy lifestyle, and it should really start within yourself. And I truly agree that to be afraid is normal, but one thing is that you have to overcome that fear by doing what you think is the right thing, to be strong, to get better, because eventually we'll get there, right, Doc?
True. Very
Yes.
true.
Thank you so much, Doc Calma, for your insights regarding this. I am sure that the Mashan community learned from you a lot. Kasi ako po, personally, I learned a lot about breast cancer. It's nice to have you po with us. Thank you so much, Doc.
Thank you. Thank you for having me.
During October, let us not only focus on Halloween, but also on the importance of raising awareness for breast cancer, a real disease that women and men continue to experience and fight against. I hope that in this episode of Lifeline, you gain knowledge from Doc Calma about what breast cancer is and how we can prevent it. Always remember that the color pink is a color of hope and a symbol of survivorship. Once again, this has been Lifeline. I am Zarina Ancheta, helping you to improve our lives by feeding our minds.